Hello, and welcome to Sonyabeonit channel. Today is the 22nd of March, and I am down here at Egleston Children's Hospital because baby Caitlin is going to have surgery this morning. This is something we're just going to talk about once we get upstairs, but I'm just arriving to the hospital, so I will talk to you guys once we get upstairs, but I just asked you to keep my family in your prayers, and we already know everything's going to be okay. So I'll talk to you guys once we get upstairs to the waiting room for surgery. See you guys in a bit. Bye. Okay, so we are made it upstairs to the waiting room for surgery. They have you come down like on a different floor to wait for her to come out of surgery. But yeah, we've been riding and riding. They had some kind of race this morning going on around the hospital, and out in this area they have like different law schools, Emory. I mean, you have a lot of stuff going on around this area. So this is a large waiting room that we're in. That's how the waiting room is looking. The lady and George sitting in the corner. Let's look out the window. This is what's going on over here. I'll tell you, I'm tired. I am really tired because the day before, Saturday, I went to, what's today, y'all? Sunday? What's today? Sunday? Saturday? See, I don't even know what day it is. Where? Oh, really? Oh, that's neat. But yeah, Friday, I went with a friend of mine to his auntie's funeral, and the day before that I stayed up, so I haven't had any sleep really. And last night is when Lady brought the baby over to Egleston Hospital because I encouraged her to take her over to the clinic in our area. They have like a little, the emergency clinic that you can take a child to. So she took the baby over there, and they informed her that she needed to come to the hospital. Now this is what's been going on. Lately, my baby, which I know this is my playmate, she had been, anytime that she ate a food, she was always throwing it up, vomiting. Now we know baby's going to spit up and, throw up just a little bit, but when I tell you it would gush out like the Exorcist, she was throwing up like that, and a lot of times she was appearing as if she was choking. It appeared as if she was choking. So, yeah, I just knew as a parent of 5, I just knew something was not right. She took her to the emergency room, to the regular hospital, and they told her, I said, look, you got to take her to the hospital. Took her the first time to the hospital. They said, okay, maybe she have acid reflux. So, or it may possibly be her milk, her formula. So they changed that. Still something was wrong, so I made her take her back again. Same thing. She went to see her doctor. Doctor said maybe it's the milk. But in the midst of all these maybes, no one thought to do an ultrasound on my baby. Now, Friday, she went to the emergency room, and they gave her this medicine to give her before feeding. She was to take this medicine 30 minutes twice a day before feeding, and that would help her food stay down, because she do have a lot of acid reflux or something of that nature. So Saturday, I was holding her, I just fed her, and she threw up something terrible. I had to take a shower. And I said, you know what, something's still not right. So this time, go ahead and take her to the baby's outpatient emergency room. They have it, which they have them in all areas, which is a beautiful thing. So once she got over there, that's when they discovered that there's an intestine, or there's this valve that's supposed to open and close. It's not properly doing that, and that is why all of her food is coming up. And she has lost a little bit of weight. So you know what? Everything happens for a reason in its own time. And this morning, they're doing surgery on her at 10:30. So we're sitting up at the hospital waiting for her to come out of surgery. But last night they had a hard time trying to do like a blood vein or to even do an IV. So they had to send some specialists in on that. So yeah, but everything's gonna be okay. Everything's gonna be okay. I told Lady that
Amen. Like
everything happened according to how it was supposed to happen. For us catching this before it was really, really bad. So she's in surgery. The doctor said, I asked them what's the downtime. They said normally kids go home the day after if they do pretty good. But I want to say this for all you new moms or new grandmothers, grandparents who have not had a baby in a long time, such as myself. Make these young people take these babies. If they cough wrong, you head over to the emergency room to make sure that, everything's okay. But mainly if you have a children's emergency room in your area, take the baby over there just to make sure everything is okay. If you don't have the money to pay for it, fine. Worry about that later on, because their health is more important than anything. So that's where we're at right now. She's out of surgery?
Oh, it might be. It don't take but a second.
Huh? We're trying to see if she's out of surgery right now. I really don't want to hear that. Get over there.
It doesn't. It's just nervous, like.
Nervous.
It's building.
Hey, you take it.
Yes, I am.
They through?
And everything went well.
Great.
And Dr. Dorham is going to come over here and talk to us. And she's starting to wake up, and we'll take her over to the recovery.
God is good. We just got the word that everything went according to how it was supposed to go, as I stated. The doctor's on the way down to talk to us in reference to baby Caitlin. She's waking up right now, so yeah, my baby going home tomorrow, okay? But yeah, I will see you guys on Monday. I've been MIA for a week, just needed a break. Still working on other videos that will post very soon. But yes, thank you so much for taking the time out today to watch this particular video, because it was a very special video and very needed in reference to other, new moms who may be going through something and not know what to do. Take your baby to the emergency room, to a children's emergency room where they specialize in newborns. It's 3 weeks.
Because her pyloric, so we got it taken care of. It seemed like it was, she has pyloric stenosis, but it seemed like it was very early. It's usually, if you get these, they're usually hard and the muscle just cracks because it's been
working hard.
Working so hard. Hers was mushy, and so it was a very difficult operation to do. I'm not very satisfied with the operation, but I think she's safe. But we're gonna have to watch her over today and see how she eats, because if you don't crack the entire muscle all the way, it continues.
Go back.
It continues continue maturing. Like if we have a baby that comes in and their measurements don't meet pyloric stenosis. So usually we look for the measurements being 4 millimeters thick and 16 millimeters long. Hers was 4 millimeters thick and 18 millimeters long. Sometimes we get babies that are 6 and 30 millimeters long. So some babies go on a lot longer. Usually when babies have pyloric stenosis that have been going on for a while, their labs are abnormal. Hers are perfectly normal. So I think she was in this early stage of this pyloric stenosis, where hers is just a much more slow process than other babies. So she's safe. We didn't get into the intestines, but I'm a little anxious to make sure that we got all the fibers torn for her, so things will go through.
What about the formula? Because her formula has been changed 3 times.
Usually after pyloric stenosis, you go back to whatever the most original formula was, because we'll keep feeding her. I've never had this happen. We do a lot of these. We do 4 or 5 of these a month here, and so I've not had one quite this mushy before, so I don't know exactly how. But we're going to feed her the regular way, because I'm not worried about the operation in terms of safety for her. I think just how effective it was, and if there still are, what I didn't want to do is keep pushing, because the problem is you then open up the intestines, and then you set up a whole other set of problems.
Right.
So I figured sometimes good enough is enough. And so we're just going to wait and see how she does. If I need to go back and open up some more, I will. I just don't. I didn't want to hurt her by being over there. Hers is.
So the stomach gonna be kind of sore a little bit.
This is usually my favorite operation.
It is?
Today was not my favorite operation.
Oh my goodness.
Because it's usually a quick operation. It's just it's nice. Everything opens up, and but hers was hard. It was we still left just 3 little holes. But so I'm gonna.
How long does that take to heal?
There's a stitch in the belly button. The other 2 little ones just have glue on them. So I mean, the glue peels off in 10 days, 2 weeks. The stitch takes about 3 months to go away. You'll never see this below the skin, but it may feel sort of firm for a couple of months.
Okay.
But in terms of pain, they usually need Tylenol Motrin for a couple of days, and that's usually it. But usually they go back to their normal sort of self.
Okay, well, it sounds pretty good.
The only other thing to remember is, does anybody in the family have this?
Acid reflux?
No, that pyloric stenosis.
Not that no, I've never had, and I have 5 kids. That's one of my daughters, so.
The only girls pass it on a pretty regular basis. So she potentially could have. Boys pass it on a little more, but girls really pass it on. It's something like a quarter of the girls will pass it on to their children.
Okay.
So she has a high chance of passing this on. So if, don't forget about this when she's
Right.
having babies.
Okay, sounds good. Thank you so much.
Okay, and we'll keep a close eye on her.
Thank you.
We'll,
Will they be able to see her in a little bit, I guess?
yeah, so she's in the recovery room now just because there's other kids there. They don't have families come back there just because there's
Germs and
privacy.
stuff. I understand.
But then you can go back to her room and she should be back there in about 30 minutes.
So they can sit in their room. We can't.
You can go to her room too.
Okay. all
Yeah,
right.
and on the rooms on the floor, there's not really a limit to number of visitors.
Okay, great.
So it should be okay.
Sounds good. Will they come and let us know or call?
They'll call and let you know when they're headed.
Thank you so much.
Okay.
So much.
Okay. We'll get to, we'll sort this out.
All right.
She is cute.
Thank you.
Yeah, but it is interesting that she got a little different course than sounds like the other ones too. But we'll get it sorted out.
Thank you.
Yeah.
Okay, so now we're heading upstairs to see baby Caitlin. She's just coming out of surgery. Look at this. It's cute. What floor?
We don't sit on.
Okay, yeah, we just walking. They don't even know where we're going, trying to get to our baby.
Come on, baby.
Shut up.
That's what we gonna do.
It's cute. It's gonna turn into a fishing aquarium. Isn't that cute? Isn't that cute?
That's sweet.
Come on, Rodney. We gotta find our way around. Oh, the butterflies.
Fish curl.
Look at Dory.
Dory was black.
That's Nemo?
Dory was black.
Is they real?
Is that Nemo?
That is. They got a whole bunch of Nemo. Y'all lost too?
Yeah, here come my baby. Look at her. Look at my pokey poo. Hey, Nene, baby. Hey, Caitlin. No, I don't know if it's her name right. But she know it's her Nene, don't you, baby? Yeah. She knows it's her Nene. She has like 3 small little incisions on the side of her belly button. I think they said they slid a little bit at the belly button. But, I mean, you can't tell it. She's not going to be able to tell it once she get older, so. She's not going to even remember this surgery, so, yeah. But we're going to wait until they say what time they're going to feed her, and I will be back. Well, maybe not no light later. She probably need it. My baby's still looking at her show. She like looking at TV. You know, I started this when she first got home from the hospital. Keep my family in prayer because I know God has us covered, but sometimes we need that extra added angel to do their part as well, and you are that person. I'll talk to you guys and see you on Monday with some more new videos. Until next time, be blessed. Bye, y'all.